Did you know that many medical affairs teams unknowingly sabotage their own success by skipping this simple yet very powerful step? Carlos, tell us more and what you've seen happen 1,000 times.
You're absolutely right, Petrina. We sometimes spend a lot of resources and effort in creating a great strategy, tactics, engagements, content, and we try to measure the impact, but then we just stop here. And it's more like a linear journey that we're doing. And we need to evolve and move from that linear journey to a more circular one by adding just one important step that, as you mentioned, and that is course correction.
Awesome. You guys stick around. Carlos is going to tell us all about course correction and how this is going to help you move the needle. My name is Petrina. I'm the creator of Medical Affairs Strategy Hacks. Thank you so much for being here. We have a super special guest today, Carlos Eid. Did I pronounce that correctly?
Yes?
Oh, good. Okay. Is joining us today to talk about this really important and simple step that medical affairs teams can do to move the needle. Carlos, thank you so much for joining us. We're so excited to have you.
I'm equally excited as well. Thank you.
Good. So let's dive in a little bit more about what you said from this linear journey to this circular journey. Tell folks what you mean by this.
So I do realize that sometimes when we look at engagement or when we look at the strategy in general, we start with, okay, this is our strategy. These are the tactics. I'm not going to go into the subdivision of strategies, with which I'm not a huge fan of, where you start having the medical strategy, commercial strategy. For me, there should be like one strategy. And then you go into your tactics, and then you start your engagements with the content and everything. And then when it comes to measure impact, we find it really hard to measure impact. So we just say, okay, let's just measure activity. And that's it. Your year ends. And then you say, okay, I've done a lot of activity. That's really great. And you get all these questions. Okay, but how are you measuring the impact of medical affairs? What is medical affairs doing? And what I recently proposed in a framework, which is more of a circular framework, is first and foremost, let's have the patient at the center. Let's put the patient as the center of attention and really think about, what is it that I want to change? What is the outcome or the output that I want to impact for those patients out there? From there, I work on my strategy, I work on my tactics, and then I do the medical impact plan. And only then I select the right stakeholders that can help me achieve that impact. I engage, I measure the impact, and also there are many suggestions on new impact frameworks or new metrics that go beyond activity to really measure the impact and the progress you're doing as a medical affairs associate. And the most important step for me is course correction. Why? Because you need to look and see if you're making any progress. If you feel that you're doing a lot of activities, but you're not moving the needle, when will you really sit down, reflect, and think, what did I do wrong? Did I select the wrong stakeholder? Did I select the wrong tactics? Do I have the wrong strategy? So this piece needs to be in there so that you are able to really drive the impact that you're looking for.
I love that. I think we've all experienced that working across different medical affairs teams and organizations. Medical affairs people are doers, right? We do. We do a lot of stuff, but as Carlos is mentioning, we're not pausing and taking a break, reflecting on what we're doing and if we're doing is the right thing. So I think this step to introduce the course correction is really powerful. Carlos, describe to us what the course correction could look like. Is it kind of meetings, or how would you recommend people start implementing course correction?
So course correction is very simple, yet very powerful. For me, course correction is, if I have a plan and I say, I want to achieve, so maybe if I give an example, it will make things much easier. If I say that my patient outcome is increasing the percentage of patients who are discharged on guideline recommended therapy for a certain disease area. And then I develop my tactics and my medical impact plan saying, okay, we need to do this, we need to do that, develop a certain protocol, do a certain study, real world evidence generation. And then I select the stakeholders that can help me in those impactful contributions, if you want to call them, or these activities. And then I engage, and then I measure the impact. At some point, I need to see that if I'm doing a ton of engagements, but none of those impactful contributions or activities, I'm able to achieve them or to move the needle with them. Or if I look at my real world evidence, I see that nothing is changing in terms of treatment, then I need to course correct. Now, the timeline for course correction, it all depends on the activity. If we're talking about a solid, like an outcome, maybe you need 2 years to really see if you're moving the needle or not. If you're talking about a certain study, maybe you can course correct or reflect in 6 months or 9 months. If you're looking at an educational activity, maybe you can try to see and course correct in 3 months or 4 months. So it really depends on the activity and the impact measure that you're doing. But my tip and my advice is whenever you can assess a certain outcome of an activity, sit down, reflect, look at the outcome, and say, am I on the right track? Or is there something I need to do differently? Because if you really go off track for a long time without reflecting and trying to course correct, it will be much harder on the long run. You will have spent a lot of resources, a lot of time, versus really course correcting at a shorter timeline.
So you guys heard this from Carlos directly, and this is something we talk about a lot on the channel, the need to review your progress and track it. I have a number of tips and tricks around that, so I'll link those up above for you. I love that, Carlos. It's really about pausing and reflecting. Do you have any tips for MSLs to do this in their daily work? I know you started out as an MSL.
Absolutely. So, course correction, of course, you sit down, you reflect, and you see the progress that you're doing. But I encourage MSLs, and I'm sure there are hundreds of them doing that already, always include as much as possible your cross functional team. So you have your sales reps, you have your key account managers, and of course, depending on the life cycle of a drug, if we're talking pre-launch, you will not have sales reps, but you get the point. Try as much as possible to involve the cross-functional team, get their feedback, and try to see how we can, all of us, move the needle, because we should no longer be working in silos where each function on its own wants to drive impact. Collective impact is much more powerful than each one alone. So that would be my first tip for the MSLs. My second tip is it's not always the fault of the strategy. It's not always that the strategy is wrong. You might have the wrong tactics. You might have the wrong stakeholders. Believe me, I've seen a lot of times where we're engaging the best of the best, like the top KOLs. I'm not saying these are not good stakeholders to engage with. They are the best. But maybe for that impact that you're driving, these are not the right ones. They are maybe right ones for a publication or for a trial, but they're not the right one to drive the impact that you're looking for. So don't be afraid to engage a rising star. Don't be afraid to engage a non-HCP. Try to engage the people that will really drive the impact and not people that will look great on paper. So that would be also my second advice.
That's great. I totally agree. We tend to be working in silos and not incorporating or including cross-functional partners as much as we could be. And at the end of the day, this also impacts the ability of medical affairs to demonstrate value. So you guys check out Carlos's frameworks. I think they're all geometric shape based, correct? You have triangle, circle. He's coming out with a square. Check that out as well. If you don't follow Carlos on LinkedIn, you definitely should. He puts out a lot of very valuable content. We highly recommend that you incorporate course correction into your stakeholder engagement strategy, your strategic planning. We have more information on the challenges around this on the Medical Affairs Value blog. I'll link that up here. Definitely check that out. I want to thank you again, Carlos, for sharing your experience and knowledge. It's super valuable. And I think you're spot on with this need for more course correction. Any final last words or tips you want to share?
No, thanks a lot, Patrina, for this opportunity to share my thoughts and my ideas. And I really appreciate that a lot. And I'm more than ready for people to connect and also to ask me any questions around that. And I'll be happy to answer and support anyone.
You might regret offering that because you'll get so so many. All right, thank you everybody for tuning in. If you found this content useful, please be sure to like and subscribe to the YouTube channel. It really helps it out. When you're on the Medical Affairs Value blog, subscribe to the newsletter. I produce content like this on a weekly basis, and you can get a nice little summary email to your inbox every Monday morning. Thanks.